Is the dose too low? Are alcohol, diuretics, kidney disease, obesity, or diet keeping the uric acid high? Many patients need more than 300 milligram per day, and the FDA approved maximum dose of allopurinol is 800 milligram a day when carefully titrated and monitored. I had patient yesterday. I saw him yesterday because he has history of morbid obesity and the gout, and he eats chicken and rice 3 times a day. He has lots of metabolic issues, and he has been on allopurinol 300 milligram a day. He's non-compliant. I saw him yesterday after a year. His uric acid is still around 8, so I had to double his allopurinol from 300 milligram to 600 milligram. Although his kidney function has been okay, but I also ordered some labs on him to see what's going on with him metabolically. So the question is that if the allopurinol dose is not maximized, you cannot assume that medication has failed.